My name's Nayana Vootakuru. I'm a physician from Sydney, Australia. I was practicing in anaesthetics. I also worked as a diplomat for the Australian Foreign Service and also worked in a sort of disparate outback Australia where conditions are very poor. Public health was a way to be able to do it at a bigger level, not only really play the game, so practice medicine or deal with individual communities, but really change the rules of the game. What really excites me about public health is that it is one of the crux of what's happening in the world today, whether it be pandemics, whether it be humanitarian disasters, natural disasters, terrorist attacks and so on. It's about strategic thinking, big level, high level planning, changing the way we do things, but also about real technicalities. How do you deliver vaccines to a small village in Africa? Or how do you ensure that a patient is compliant with their medications? So everything in between. Increasingly, I think medicine is not operating in the isolated bubble that it had in the past. It's very normal for clinicians to have done medical school, then had a patient load, set up a clinic and worked there for their whole lives. Now I think it's time for clinicians to step up to the challenge, the bigger challenges of how health systems work, how they can be made more effective and more efficient, and also more equitable. Ideally, what I'd really like to work in is policy, whether that be domestic policy in Australia or global policy with a multilateral institution like the UN or the WHO. And ideally what I'd like to be doing is looking at health disparities and how we can really address what to me are the biggest challenges of the day: poverty, HIV/AIDS, lack of access to clean water and sanitation, and also disaster management. If you're lucky and you work hard, you have the opportunity to leave the world in a slightly better way than what you found it. So I think that's a really satisfying and rewarding aspect of public health.